Hello there. So today I'm going to talk to you about parvo disease. This is a little bit of a complicated disease, so I'm going to talk about the disease itself in this video and then talk about treatments in a later video for this. So parvo is a viral infection that we frequently see in puppies, but we can see it in older dogs that are not vaccinated. The most common clinical signs we're typically going to see with it are bloody vomit, bloody diarrhea, lethargy, or just kind of acting like we're not feeling very good, and inappetence. The problem with parvo is it is a very tough little virus, and it can kind of live everywhere. So in the area that I live in, it is considered what's called ubiquitous, where it is kind of everywhere. So it's hard to prevent. That's why we recommend vaccinating for it. So parvo tends to attack two places in the body of a dog. One, it will attack the bone marrow, which is responsible for making red blood cells and white blood cells. Your white blood cells are what your body uses to fight infection. It'll also attack the GI tract. So it attacks the cells on the very inner lining of the intestines, which causes them to slough or die off and kind of be expelled. That's usually what the blood is whenever they have diarrhea or vomiting, are those cells that are sloughing. And when it does that, it allows the bacteria that naturally lives in that intestinal system to penetrate into the bloodstream and results in what's called sepsis, which is a whole body bacterial infection. And sepsis can 100% lead to death. The biggest things with parvo are controlling vomiting, controlling dehydration, controlling infection, and trying to get them to start eating calories. Now, parvo is a disease that absolutely can be treated at home in some scenarios, but the biggest issue is getting the vomiting under control. You cannot at home treat their dehydration and their calorie intake if they're actively vomiting. Parvo is something that we have seen some up and coming strains in some of our southern states that have been a little bit harsher than others, but the research on that is a little bit limited. It is something that we can test for in clinic. Most clinics are going to have a test that you can get results in 10 or 15 minutes, so it's easy to find out relatively quickly if your patient has that. Now, when I talk in the next video, there's multiple different layers of potential treatment for parvovirus, and unfortunately, it does typically come down to funds. You have some very expensive options, you have some very cheaper options, but no option is 100% with treatment on this. So catch my next video, we'll talk about just general treatment options for parvovirus.